When I was a medical student planning a career as a fertility specialist, I thought the most important work I would do would happen in the IVF operating room. It's a dramatic image. We can all envision it, right? A precious embryo, a cluster of a couple hundred cells, a woman or a couple dreaming of the baby it might become, a medical team working with intense focus. 9 months later, new life brought into the world. But what took me years to realize is that some of the most important moments in reproductive health care come long before anyone steps foot into that room. The story starts much earlier. Whether it's a spontaneous pregnancy or in vitro fertilization, IVF, the story starts long before that pregnancy test is positive, long before the trying to conceive journey even begins. These moments are quiet. They happen in kitchens, in bedrooms, in grocery stores and break rooms and doctors' offices where no one is thinking or talking about babies at all. These moments profoundly shape reproductive health outcomes, and yet they're the ones our healthcare system almost always overlooks. The United States is facing a reproductive health crisis. Despite having one of the most expensive healthcare systems in the world, our reproductive health outcomes are among the poorest in developed countries. Fertility is declining, infertility rates are rising, pregnancy complications are rising, maternal mortality rates, especially among Black and Indigenous people, are heartbreakingly high. This is not just some public health issue. It's a human issue. It's a family issue. It's a future of us issue. What we need to understand is that these moments start far earlier. There is so much we can do to influence those outcomes. And so I want to tell you a little bit more about a patient that I think about often. Her name, I will call her Mina. Mina came to me after years of trying to conceive. She was kind, determined, hopeful. She had already seen plenty of doctors. She had spent thousands of dollars. She had already experienced heartbreak after heartbreak. As we went through the nuance of her story, she paused to ask me, why didn't anyone explain this to me before? What she was talking about were the small details and connections. How the blood sugar imbalances related to the prediabetes she was mostly ignoring connected to her ovulation patterns and the chances of higher complication in pregnancy. How poor sleep and chronic stress impact fertility and pregnancy. How her health, and critically the health of her husband as well, would impact treatment outcomes. And through epigenetics, the science of how genes are turned on or off based on the environment around us, how it would shape the pregnancy and form the blueprint of their child's future health. We are not as predetermined as people sometimes think. Our genes are powerful, but think about a sibling, a cousin. What similarities, but also what differences come to mind? How we become who we are meant to be is an incredibly complex phenomenon, and environmental factors play a large role in that. But one thing that is simple, a straight through line, health before pregnancy impacts pregnancy outcomes. We know that. We see that when we look at pregnancy health before achieving pregnancy, it impacts what happens during the pregnancy. Those outcomes in turn predict a woman's midlife health and longevity while also molding the health of the next generation. This is an important concept. If we truly want to unlock our health span, the key is hiding way upstream in health before conception. What I realized about Mina, she wasn't angry. She was just tired. There was this part of her story that had been left neglected, unaddressed. And now, years later, she was wondering what could have been done differently, better, smarter, if she had just fully understood it before. It's been through conversations like this, year after year, that my conviction grows. by the time someone is sitting in my office, we've missed a critical window of opportunity. For decades, we've told people to wait. Wait until you're financially secure. Wait until your career is perfectly established. Wait until everything seems perfect. And by then, when fertility has inevitably declined, we offer our imperfect solutions. They may be expensive, emotionally laden, they may be exhausting. And yes, I'm grateful that these miracles exist. It is my professional privilege every single day to see the miracles of modern medicine. We need to democratize access to complete fertility care, full stop. This is very important. But at the same time, we need to think critically about the entire environment around how we build families and how we think about fertility. Here's what the science tells us. It confirms things that people have long intuited. What we eat matters. Across the world, study after study shows what we put in or on our body can help us or it can harm us. How we move, how we sleep, how we deal with stress, all of these things inform our general health, our mental health, and our reproductive health. Exposure to toxins, social disconnectedness, poor nutrition, chronic inflammation can all affect fertility and pregnancy. Health before pregnancy impacts those pregnancy outcomes, and it bears understanding that indeed improving health before pregnancy is the only intervention that we have that can not only improve fertility, but also positively impact the pregnancy and child health outcomes that follow. This is an investment worth making. Of course, personal choice is only part of the picture. We can't talk about reproductive wellness without acknowledging the structures that support it or more often sabotage it. How can we expect people to prioritize sleep, nutrition, stress management when they're holding down 3 jobs, when their neighborhood lacks access to safe spaces to move, when instead of fresh food, they're facing ultra-processed options at every turn, when they can't access reliable health care, when their job punishes them for taking time off? True reproductive health care doesn't just require advice, it requires advocacy. So what do we need? We need paid parental leave, affordable childcare, workplace and environmental regulations to protect our fertility from infancy and beyond. We need reliable access to legally protected and evidence-based high-quality health care, and reproductive education that begins before people are in crisis. These are not luxuries. They're the scaffolding of a healthy society and something we can all advocate for. And so I would say that the most important health lesson that I've learned didn't come out of a textbook. It came out of listening. It came out of seeing what my patients truly want. Not just a baby by any means, but a healthy one, as simply as possible, with agency and autonomy along the way. It's time to stop treating healthcare, fertility, as something that we wait to witness until it's broken. We need to start treating fertility not as something that we fix, but rather something that we nurture. Because the future of reproductive health care doesn't begin in the delivery room, not even in the IVF laboratory. It begins in those quiet moments where no one is watching, where no one is pregnant, but everything still matters. Thank you.